You know, many find it hard to believe I own a sleigh that can fly. But you know what I find hard to believe? The unbelievable offers going on at the winter event.
The Mercedes-Benz Winter Event is back with incredible offers on the sporty CLA, the thrilling C-Class, the versatile GLA, the safe and secure GLE, the innovative GLC, and of course, the unequaled E-Class. But hurry, because these sleighs are going fast. Visit MBUSA.com/winter event. Mercedes-Benz, the best or nothing.
Blog Talk Radio.
World won't get no better if we just let it be. Na 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 na. The world won't get no better. We gotta change it, girl. Just you and me.
Welcome to this week's edition of What's New with VHHughes. I'm your host, Venus Henderson-Hughes, and on the line I have Vanessa Henderson. How are you, Vanessa?
I'm good, and you?
I'm good. So this week we're talking about the Affordable Care Act. And when I say the Affordable Care Act, I know everybody probably rolls their eyes, but this week's look at the Affordable Care Act is basically looking at why there was a need for the Affordable Care Act. When I think about, okay, so we're from Michigan, and you know our neighbor to the north of us, Canada, has free health care. And I remember working with some nurses at Children's Hospital of Michigan. Shout out to Children's Hospital of Michigan. And I would ask them, I said, you know, you guys live in Canada, you get free health care. You know, why even take the insurance on the state side when you get free health care? And they said, well, it was a long wait. But the Affordable Care Act is something totally different. There are premiums that come into place, but there are affordable premiums. And it actually opened up a lot of things for people who probably couldn't afford it, such as preventative care, like birth control. Those can be expensive. So this act, although a thorn in the side to the insurance companies, if you will, did benefit a lot of people. So, Vanessa, you know that when I worked for some companies, and you know, there were times where we seriously had to decide whether or not we really wanted to go to the doctor because we couldn't afford to actually do the copay, let alone pay for prescriptions. So what do you think about the Affordable Care Act in regard to allowing people to get, you know, health care? Vanessa?
Yes, I'm here.
Did you hear what I said?
Yes, I mean, the thing is, though, a lot of people kind of got their hopes up with that. Especially, I know a couple of people personally who were looking to get the insurance, and it didn't happen. And you know, and the reasons that were given were really not sufficient for those people, you know, especially with it being televised daily that, you know, everyone after the first, you know, would be able to have health care, be able to go to the doctor and see what's wrong with them. And now lots of people are getting this bill for phenomenal amounts of money.
Okay, so I'm sorry, not meaning to cut you off, but did they think that they did not have any copay? Did they, in other words, did they believe that it was like Canada where it was free health care? Is that what they were under the impression of?
I mean, no, they were kind of under the impression, like, you know, that, yeah, at some point they would have to pay something, but they would be able to go to the doctor at least without having to pay something. You know, at least they would be on the state's insurance where, you know, yeah, you may have a copay for your medicine or your visit for a particular type of doctor, but at least going to the hospital, you know, that should be covered, you know, especially if you don't have the money for urgent care, you know, that's, and then a lot of people, you know, and I guess now if you are a single man, you can't have insurance, period, no matter if you're homeless, no matter if you, you know, you have needs, like a coworker, he went to the hospital, he doesn't have insurance. He had to go by ambulance. He had a heart attack. He had to go, and he's in a heart hospital, but, he has this phenomenal bill. And then other people who've gone to the doctor, they can't get the prescriptions, like phenomenal amounts of money. They have the Walmart thing where they get the little cost, but still, some of those prescriptions, depending on the medicine, is still expensive. So I guess the real thought was, this would be them giving everyone access for Arizona, Medicare or care, and it didn't happen the way that it was thought to happen.
So I think one of the things that I'm hearing from you is that education is key. I think that some of the thought processes behind it was the case of thinking that, again, it sort of may have mirrored the Canada plan, whereas that everybody will receive free health care, but it's not exactly that. So I did some research, and, of course, I'm huge on research, and I went on the Affordable Care Act website, the healthcare.gov website, and so because I wanted to know, because of course working in the healthcare industry, and I remember the whole feeling of doom and gloom when this came about, and me being me, I saw it as a wonderful thing because it opened up the doors for people to be able to get health care. And of course that's why H3P exists. We want people to be able to get health care. So something such as this was opening the door for that. So I thought.
Now I can tell you.
What I found is that each state has their own thing.
Right. But now I actually have a letter and now this letter, when you read it, you will believe that you were to get. Now, I already have access.
Right.
However, they sent out this mass letter of any and everybody, okay? Now, what the letter states, because I still have it, it says, that after the 1st of January, everyone will be eligible for either, one, a taxable insurance or a tax, depending on what kind of age group you were for an insurance, okay? Now, it didn't list any specific, things that would admin or disqualify you, per se, from it. What it says is that, you will be eligible for either tax-deductible insurance or non-tax-deductible. All you have to do is reapply, and, by the 1st, and you'll be able to receive this insurance. A lot of people did such that thing, and that letter, even though I already had it, was still to me like, hey, everyone can get it. But after several hundred people applying, it's like, no, you can't do it because of this, this, and this. And so it's just kind of misleading in a way.
Join the conversation with us. Guests, please dial 347-826-7959. So, as I said, I went on healthcare.gov, and what it had on here, and it basically explained the value of the Affordable Care Act, and it says better value, making sure 80 cents out of every premium dollar goes to your care. Health insurance companies now have to spend at least 80 cents of your premium dollar on your health care or improvements, or provide a refund. And they also said that they made transparency in health insurance rates. Now insurance companies in every state must publicly justify any rate increase of 10% or more. Since this rule went into effect, the fraction of the issuer request of premium increases of 10% or more has dropped dramatically. Stronger consumer protections. Insurance companies can no longer cancel your coverage because you're sick or because you made a mistake on an application, which is great because, when you're filling out those applications, you can make mistakes. So that's great. They can no longer limit lifetime coverage on a fixed dollar amount, and I'm familiar with that because, for instance, fertility. A lot of insurance companies had a max benefit, max lifetime benefit on fertility. When a couple is trying to have a baby, things don't automatically work right away. So you may need to try a couple of times, and you can definitely max out quickly with those type of drugs. So there's no limit there. No more denials for pre-existing conditions. Now, this was one of the things that really piqued my interest, if you will, because of the fact is that there are so many pre-existing conditions, especially, for instance, you and your sister, you asthmatics, that would be considered a pre-existing condition. And because of that, insurers can no longer deny coverage of children for that. And also everybody else, it says beginning 2014, health insurance will no longer be able to charge more or deny coverage to anyone because of pre-existing conditions. When it first started, it was for the children and elderly, and now it has extended to other people. Keeping young people on their plans. Now, a lot of the health insurers had already started that, where they were sort of extending out to 26, and so this sort of coincides with that. And they have, different things on here, and it does look like a huge benefit, if you will, for people. Now, I was one of those people, like I said, I had a full-time job. One of the times I actually worked at a healthcare company, but when it comes down to actually having the benefit, it's great, but being able to use it, that's the thing that we sort of miss, because it's great to have it, is to that comfort zone, that security blanket, if you will, of having your insurance, but then if you can't afford it, what's the point? I mean, you're paying that premium every single solitary month, and yet you can't even afford to go to the doctor. The best thing that you could do was to go get the preventative care, because that, at least, you didn't have to worry about that, but you still had a copay if you went in. Like, you can't win, basically.
Right. So,
one of the other things that I looked at was the lifetime and annual limits on the healthcare.gov website. And it said that the Affordable Care Act prohibits any health plans from putting a lifetime dollar amount on most benefits you receive. This law restricts and phases out the annual dollar limits a healthcare plan can place on most of your benefits, and does away with them entirely in 2014. And, of course, we're in 2014. What does this mean for you? Before the healthcare law, many health plans set an annual limit amount, a dollar amount, on the yearly spending for your covered benefits. Many plans set a lifetime limit, a dollar limit on which they would spend to cover your benefits during the entire time that you were enrolled in their plan. You were required to pay the cost of all care exceeding these costs. Under the law, lifetime limits on most benefits, and they don't have here what those benefits are prohibited in any plan or insurance policy issued or renewed on or after September 23rd, 2010. The law restricts, phases out an annual dollar amount that all job-related plans and individual health insurance plans issued after March 2013 can put most covered benefits. Specifically, the law states that none of these plans can set an annual dollar amount limit lower than $750,000 for a plan or policy starting on or after September 23rd, 2010. But before September 23rd, 2011. So, but again, they phase out all annual dollar amounts on January 1, 2014, which we've seen that. It says, please be aware that plans can put an annual dollar amount or limited lifetime amount on a spending for health care services that are not considered essential. And that word essential, of course, is to the discretion of the health plan. So, again, when it comes down to the Affordable Care Act and how the benefits are covered, of course, it's a state-by-state thing. What covered or what goes for, say, Arizona is not going to be the same as Florida or Michigan or anything. So that can also be an issue as well, because say if you got covered in Pennsylvania and you moved to Florida, your benefits could possibly change because you're in another state. It's not a universal plan, if you will. So that is something to sort of look into more so about. The one thing that I do really like is that preventative care is covered at no cost to you. You go in and you go see the doctor and you don't have a copayment. So that's a plus. So all the things that you may need to do or whatever to benefit your health, that's a wonderful thing. You know, it gives you a decent array of doctors, and it also removes insurance company barriers to emergency services. So you can definitely go to an emergency care provider outside of your network and not be penalized. So that's a plus. I understand with any new thing, there are plus and minuses. For some, there are huge minuses with the Affordable Care Act because of the fact is that, when you speak of mainly of them, they are in the insurance provider division. That whole revamping, if you will, of changing their health plans to cover birth control for free. That was a huge hurt to them because those were dollars that they weren't making. So that, in essence, hurt them. They have to pay out that cost. They have to eat that. So that was something that was really hurtful to them. And yet, they had to comply. So there is a benefit there.
Well, what I found out is two things. Now, the government will give anyone, majority, I can't say anyone because even still, but instead of giving you insurance, if you are a single man, you can get food stamps. You cannot get insurance unless you either have kids or you are married. And I just think that is kind of crazy because
I would have to look more so into that.
I've actually gone down there and actually sat with someone doing there. They literally told them that they either had to.
Okay, but that what are you talking about? That's for access. But this here is something that you pay for. You pay your premium.
No, yeah, but I'm saying in general, like there are some people who lost their jobs or don't have jobs, and there's also people, veterans, who retired.
Look here, girlie. I remember when, one of the seniors that I grew up with, so she was able to get a Medicaid card, but her food stamp she only got one food stamp a month. What is that?
And I know seniors who don't have either or can't get either for crazy reasons. Like like I said, some of the veterans that I know, they can't even get insurance, and it's like what?
So veterans are allowed to get free care through the Veterans Administration, so they can go to the Veterans Administration and get care. So they can be treated. But this has nothing to do with the Affordable Care Act. The Affordable Care Act is basically literally allowing you to pay for your insurance in your budget. And with me right now, currently I'm not working. The thought process of this option for me, when it comes down to it, and of course, to have the company, whatever company that I'm blessed, of course, to join at some point, the thought process of them having the plans that are now available in the Affordable Care Act available for me to get is great because, you know, the high deductible plan that I used to have was ridiculous. You know, there was no way I was going to meet $2,500, you know, of cost. You know, so I would have continually had to pay out of pocket because, you know, go to the doctor that often. So it's definitely something to look at. Again, one size does not fit all, and it definitely goes for the Affordable Care Act. It is not meant for everybody. Everybody can't work with it. I know many of the healthcare professionals despised the Affordable Care Act because it you know, infringed on them in some way. But when I look at this act, this policy, this healthcare means to an end, if you will, it helps so many people out there. You know, it helps people who would not have been able to afford health care the normal way. It is for people who may be low income, who can afford a high deductible plan, if you will, at their job, but can't afford whatever the premium is for whatever plan they picked through the health exchange. And you know, that in itself is definitely a stepping stone in the right direction. It is so many people out there who can't even afford to change their mind, let alone go to the doctor and be seen and get, you know, help. When I think about that, you know, some years ago, I want to say, at least over 10 years ago, I know we had a mental health hospital closed in Detroit, and all the patients were basically thrown out into the street. Those people weren't able to get their medications, you know, because they had no way of paying for them. You talk about really high medications. Most of the mental health, the main ones, especially to deal with bipolar disorder and schizophrenia, those are some expensive medications, and to have to pay for them out of pocket is something that they wouldn't be able to do. And sure, they would be able to have, you know, money coming in from the government, but they would not have been able to pay for that medicine on a regular basis. And this here is definitely an option for those people. If this had existed, you know, way back then, we probably wouldn't have had so many issues that happened in Detroit because you had all those crazy people running around. Okay, mentally ill people running around hurting each other or hurting other people because they had nowhere to go. So that's definitely a plus in my book. Do I think that there's going to be a Affordable Care Act Part 2? Not sure on that. When I thought about this, I thought about going over the whole overview of everything. What's the pluses? What's the minuses? And everything. And I think we pretty much covered it in this brief 30-minute show. Would I like to dig more deeper into it? Yeah, probably once we extend our show some more again, once we get more listeners. But definitely, I truly think that with anything, there are positives and negatives. I think one of the main thing that when it took a hit was when it first was launched and nobody had the ability to access it because of website issues. I think that was a problem. But also I think that there were a lot of misunderstandings out there, if you will. I don't think a lot of people sort of did their homework about what this actually was for and what it actually represented. And I think if we all took the time out to sort of do our homework, we wouldn't have that frustration on the other end. But another reason why I wanted to do this show is because I saw something posted on the website, on the web, and it basically, I think it was somewhere in Florida, and of course, Florida has had its own little controversies or whatever, but there was a restaurant or something. It was a receipt, and basically the receipt had basically charged the Affordable Care Act tax. I don't know about the legality of it, and I'm not going to step into that realm, but, when I think about the fact that, in essence, the owner of the restaurant or shop or whatever it was is sort of putting their responsibility onto their customers. And when I say that, it's because, as a business owner, I'm a business owner. So as a business owner, it is my responsibility to take care of my employees. So if it's my responsibility to take care of my employees, then I have to make sure that they are covered on their insurance and things like that. Then that's what I'm supposed to do, because in essence, I am providing the service, and these people have joined my corporation or my business in order to make everything successful. So, of course, I want my employees to remain healthy. So why, in turn, would you turn around and push that onto your customers, who, in essence, are keeping you in your business? What are your thoughts on that, Vanessa? Vanessa?
Yes. Like I said, it just, a lot of the things will never be perfect. So, no matter what, there's always going to be some instance when it won't work for a majority or half. And I just think that a lot of the healthcare, what they try to do, in essence, with the older generation, is they try to, run over them, because, sometimes people don't read. And, also there's no one to help them, too.
Well,
so,
that's what H3P is for. We have things in place that can help anybody out there. We are a everyman's nonprofit. I love to say that. But
right,
you have to know when to get the help.
That's true, too. A lot of people don't know how to go about getting the help, and then sometimes when they get the help, it's a little too late, a certain aspect of life or what they were trying to do. Like, for instance, when they fill out for Social Security and things like that, there is deadlines to those things, and, not knowing how to go about it and declaring that, it's something you really want to do, there's a deadline for that. I think with being in Arizona, a lot of things are just not really organized and kind of misleading at times. So it's kind of frustrating to watch.
I believe that one should take responsibility for themselves. You cannot expect somebody to come along and explain everything to you. But there's also a time where you have to know where to go and get help. And I know we covered it 2 weeks ago with the seniors. There are places where they can go and get help if they don't understand things. And there's help for everyone. There's the health exchange. And there are plenty of commercials out there for people who don't understand the new health exchange issues and questions that they may have. These people, these organizations that popped up specifically to help with that, they're out there. They just have to seek them out. My thing is, with H3P, especially with us wanting, our end result is wanting to get free health care, and not free health care sort of like the thought process behind the Affordable Care Act, but free health care as in you come in, we treat you, you go on, and there's no copay. Now, the only thing you may have to pay for is your insurance. I'm sorry, your prescription, excuse me. But, again, there are plenty of prescribed medications that do fall into those plans, such as the one at Walmart or Safeway or Target. So there are plenty of ways to get around not paying so much for health care. But, again, I just think it goes down to that. But I'm not going to go on another tangent. But definitely when it comes to the Affordable Care Act and, of course, how you look at it. I think it's just the fact that you have to know and do your homework. And if you don't do your homework, at least seek out those who can help you with it. But that's my take on the Affordable Care Act. It has been a great pleasure being on the line with you again. Next week we probably won't be doing part 2, but I'm sure it's going to be a riveting show. So, as always, this is VHHughes, and this has been What's New with VHHughes.
Bye.
Bye.
Ho, ho, ho! You know, many find it hard to believe I own a sleigh that can fly. But you know what I find hard to believe? The unbelievable offers going on at the winter event.
The Mercedes-Benz Winter Event is back with incredible offers on the sporty CLA, the thrilling C-Class, the versatile GLA, the safe and secure GLE, the innovative GLC, and of course, the unequaled E-Class. But hurry, because these sleighs are going fast. Visit MBUSA.com/winter event. Mercedes-Benz, the best or nothing.
Ho, ho, ho! You know, many find it hard to believe I own a sleigh that can fly. But you know what I find hard to believe? The unbelievable offers going on at the winter event.
The Mercedes-Benz Winter Event is back with incredible offers on the sporty CLA, the thrilling C-Class, the versatile GLA, the safe and secure GLE, the innovative GLC, and of course, the unequaled E-Class. But hurry, because these sleighs are going fast. Visit MBUSA.com/winter event. Mercedes-Benz, the best or nothing.